Diet in Obesity and Underweight. It's chapter 15, page number 290 of the Dietetics textbook. Chapter 15, page number 290, Dietetics textbook. Those who are joining late, please help them out with the page numbers and topic name. So obesity, there is a huge and a rising prevalence of obesity and overweight issues and the health consequences that results because of obesity. And WHO has also prompted it that it is one of the most important public health problem which needs to be resolved. Okay, so that's what obesity is right now. So it is due to the positive energy balance, like intake of calorie is much more than what you exercise out or burn out. Okay, when you eat too much and you're not able to burn that out, okay, when you're not able to metabolize it out, the excess of calories will be turned into fat and it will be stored into your body, especially the calories from carbohydrates. Okay, glucose, excess of glucose would be turned into fat and it will be stored in your adipose tissue. Okay, and over a period of time, you become obese. So that's how obesity starts. So common symptoms of obesity in adults, okay, you will have trouble sleeping, that is by breathlessness due to sleeping. You can't sleep straight. You have to be, you require at least 2 to 3 pillows to prompt you up, and then only you can sleep. Okay, that is the breathlessness during sleep. And then snoring issues, sweating more than usual, shortness of breath, okay, skin problems, that is spider web kinds of veins and capillaries that burst out on your thighs, etc. Okay, so these are the obese adults issues in adults. Okay, coming to symptoms in children and adolescents, in teenagers, acanthosis nigricans, that is the dark black or dark hue of the base of your neck. Okay, dark velvety kind of skin around the neck, and also in the areas where your skin naturally folds. Okay, naturally, whichever part of your body the skin naturally folds, like your elbows, groin area. Okay, so your knees, all these areas where you have natural skin folds, the skin there tends to be darker, much darker in its color, and the texture is velvety and sweaty. Okay, that is acanthosis nigricans. That's seen commonly in teenagers. Again, teenagers will also have shortness of breath, okay, with lack of physical activity, sleep apnea. Sleep apnea is breathlessness during sleep. Okay, when you're sleeping, you're not able to breathe properly. You require a cardiac position. Cardiac position, if you Google it, you will see cardiac position is used when you want to elevate your chest region. The patient's chest region is elevated. It's not at the same in the same degree as the legs. Okay, the chest area is slightly elevated, prompted up while they are sleeping. Okay, so those who suffer from sleep apnea, especially breathlessness during sleep, they have to use cardiac position. Okay, the chest area is still at 245 degrees rise, and then they can sleep properly. In morbid obesity means people who the body mass index BMI will be much more than 35. Okay, that is morbid obesity. And they have difficulty in breathing, difficulty in walking also. Okay, and sometimes even doing their own personal hygiene, okay, maintaining their own personal hygiene, taking care of themselves becomes difficult for them. Okay, so usually you require surgical interventions here. In morbid obesity cases, surgical interventions is required to reduce the weight. That treatment part we'll discuss later. Okay. So is it clear about obesity, different types of obesity, what symptoms are associated with obesity? Now coming to genetic factors. Etiology means what leads to obesity. Okay. So genetic factors, 50 to 70% of your genes will determine are you at a risk of being obese or overweight. Okay. And also, when it comes to gender, uh, which gender do you think has the highest chance of getting obese or rapid weight gain? Which gender? Yes, it is the females. Okay. Females have a higher risk of getting overweight or obese as compared to males. It's because of the for men, the presence of testosterone, okay, the male hormone testosterone helps to maintain a lean body mass, okay, which is very less in amount in females. And in females, estrogen leads to too much of estrogen leads to fat deposits in their body. Okay, so when it comes to the gender of a person, it's usually the sex of the person, it's usually hormones, okay, which determines will you be obese or overweight. And age, obesity can happen at any age. We are nowadays we also see certain infants who are obese, okay. As long as a person is in a positive energy balance. Positive energy balance means the number of calories you eat is higher than the calories you burn. That is positive energy balance. Okay. So as long as a person is in a positive energy balance, you eat more but you burn less, you will definitely tend to have a obese or an overweight body type. Then coming to eating habits. I guess all of us would know the answer to this, but still, could you just randomly pick out any eating habits and put it in the chat box so that we all can have a discussion on that? What eating habits would lead to obesity? Yes, binge eating, nibbling on junk foods before meals, overeating, indulging in too much of sugary food, sweet, eating without a schedule, yes, indulging in too much of festive activities. In Indians, it is very common. Every month we have 2 to 3 festivals, and nowadays we live in a global society where, you can find Indians from various states and cultures in any state. Okay, so most of the state would indulge in engaging in or celebrating each other's festivals, and there will be distribution of sweets, elaborate buffet systems for your festivities, etc. Okay. Yeah, wedding season. The fast food chains are on a rise in India. Okay. Earlier it was very rare to find, like 10 a decade ago or a 2 decade ago, it was very rare to find McDonald's or KFC. Even when it comes to metro cities, it was very the number of food chains we had for McDonald's, KFC, Domino's and all, it was very less. Okay, but nowadays it is very rampant. Every even in a township you can find a McDonald's food chain, etc. Okay. And housewives, especially housewives, while cooking food, while taste testing, you will just before you eat a meal, you may just end up having a small pre-meal, and then you will sit with your family and have the elaborate meal. You cook the dinner, you will have a pre-dinner. While tasting and all, you may indulge in some tasting the snacks, etc., having a small pre-meal while waiting for your husband to arrive or something like that. And with the family, you will end up having another session of meal. Okay. Yeah, ready to cook food. So these all habits, most of the common habits that lead to obesity, on page number 291. It's a self-study points. Various points have been mentioned. More than 10 points are mentioned. Just go through it once, okay? Binge eating, yeah, binge eating because of stress, boredom. Okay. Lack of physical activity, even if you're eating adequate calories nowadays, there's a lack of physical activity. Most of the kids as well are indulged in smartphones, okay, gaming, etc. Indoors. So the calorie intake is apt to their age, but the burning of the calorie is not happening. That could also lead to obesity. Then coming to physical activity, people who lead a sedentary lifestyle, okay, and who pay very less importance to physical activity, they have a high risk of getting obese. Okay, it even though it can occur in any age, but it is especially during the middle age. And middle age, a person who is in their middle age and did not have any physical activity in their daily routine, okay, they tend to put on a lot of weight, which is anticipated by the stress in the middle age as well. Okay, the stress factors may also anticipate this weight gain. Then coming to stress, okay, food is like for some people, food is like an endorphin. Okay, they eat, they become happy. Okay, they feel satisfied. So under stressful situation, like for exams and all, if you're preparing for an exam and all, that entire week you will you will be binging on different kind of stuff. Okay, you may feel you are more hungry than usual. Okay, and as soon as the exam phase is out, you are out of that situation. Your regular routine is back. Okay, but some kids, what happens is that when they get the taste of this endorphins that which they are getting just by indulging in junk food or during stressful events, when they are indulging in excess amount of overeating, etc., they do not know how to stop it after the stressful event has become a bygone. Okay, so it becomes a part of their habit. Overeating becomes a part of their habit. Nobody becomes obese or overweight within a day or two. Okay, nobody becomes overweight or obese within a day or two. It's a habit pattern you have formed over few weeks, over few months, that leads to overweight issues and obesity. Okay, emotional eating, stress eating, these all are examples of uh, trying to like when you're stressed, your endorphins, natural endorphins that your brain is able to produce is quite less. Okay, so you are finding some external stimulants. Okay, some people may go into alcoholism, some people may go into substance abuse. Similarly, food addiction is a real thing. Okay, food addiction, being addicted to food, is also a real thing. Okay, and also people who suffer from certain mental health disorders like depression, anxiety issues, okay, PTSD. You will see the same kind of emotional eating and stress eating in those individuals as well. Then coming to endocrine factor, people who have hypothyroidism, hypogonadism, okay, hypothyroidism, not enough thyroid hormones are produced, T3 and T4. Hypogonadism, that is your sex hormones are not produced. Okay, your gonads, that is your the ovaries and testes. Okay, in females your gonads are ovaries, in males it is the testes. Okay, hypogonadism, the hormones these gonads are supposed to release, it's not being released properly. Okay, Cushing syndrome, and these all are a foundation that leads to obesity in the future. Okay, obesity during teenage or adolescent, okay, that could also lead to early menopause, hypothyroidism issues, etc. Yeah, Cushing syndrome is a disorder. Cushing syndrome is a disorder, and that happens because of your adrenal glands, which is on top of your kidneys. It's producing too much of cortisol. It's producing too much of cortisol that leads to Cushing syndrome. It is treatable, okay? The Cushing syndrome is treatable. You will be put on hormonal therapy. And usually it is seen in people who are bodybuilders as well. If you indulge in too much of steroids, okay, That could also lead to overproduced cortisol levels in your body that leads to Cushing's syndrome. Next is trauma, like if there is a head injury or your hypothalamus. Okay, hypothalamus uh, make sure that your satiety factor and your thirst mechanism is intact. Okay, your hypothalamus will guide you when to stop eating food. So, you are full, you're completely overfilled, stop eating food. Okay, that kind of signal is given by your hypothalamus. And also the thirst mechanism as well. Okay, now you should drink water. You should stop drinking water. These all are controlled by your hypothalamus. Hypothalamus is present in your brain. Okay, so after a head injury where your hypothalamus is affected, okay, when there is a trauma pertaining to your hypothalamus, your mechanism to regulate your appetite, to maintain your satiety, it becomes compromised. Okay, so the patient here, they don't know when to stop. They go on eating. They still feel, even after their stomach is completely distended out of food, but they still feel hungry. Okay, so that could be a trauma related obesity. Then prosperity and civilization. Can anyone put a statement on this particular etiology? How does prosperity and civilization lead to obesity? Any examples? Can you give any examples? Yes, high purchase power. Yes, varieties of food. Developed countries. Yes, home delivery systems. So you can see this if you take up an obesity statistics of India, okay, and you go state-wise, you will find that Indian states like Maharashtra, Tamil Nadu, Punjab, Kerala, okay, these are the states where you find high amount of obese people. Why? The GDP. Okay, the GDP of these states are naturally high. They bring a lot of income into the country. Okay, the highest amount of taxes are also paid by these states. If the state is able to pay high taxes, means the income rate of the people living there, the citizens living in these states are quite high. Okay, so it is also associated with obesity. And you can also take the world example of USA. Okay, how do we stereotype? Stereotyping is not a good thing, but usually physical, based on the physical appearance, how do we stereotype the Americans? What stereotypes have you come across about the Americans, about their physical uh, look? Yeah, America has the most unhealthy diet. It's too salty, too fatty. Okay, when you take American food culture as an example, the food is too salty, too fatty. Okay, too much of ready-made food, too much of mass-produced over processed food. Okay, that's the fad in American diet. Okay, and which have the repercussions of such diet. We have seen how what is the obesity level in citizens. Okay, more than half of their population, more than half of the American population is obese. Okay, so that states a lot about their prosperity. The more civilized a country is, okay, more it has the risk of getting obesity related issues. Okay, if you go and do a comparative studies of a foraging nomad, okay, a nomad tribe or a tribal people or people who still live in a tribal areas of India, you don't find obese or overweight people there. Okay, they forage their food. Okay, they have a negative energy balance. What the calories they consume, they are able to burn more than that. Okay, they have a negative energy balance. So with civilization, these kind of health issues will also follow. Yes, a lot of refined food as well. Then certain drugs like psychiatric drugs like antidepressants, steroids, okay, contraceptives, diabetic drugs, antihistamines for allergy. So these drugs have been associated with weight gain. Okay. Next, coming to the theories. What theories do we have related to obesity? Yes, there is a reduction in the movement. Everyone in USA, everyone they depend on cars. Very few people use the public transport. Okay, they have their own cars for moving from one place to another. So that leads to lack of physical activity as well. The first theory is your fat cell theory. So, what the snapshot of this theory is that when a child from childhood, if a person is obese, okay, antihistamines are allergy medications to treat allergy, hives, etc. Antihistamines are prescribed. Like cetirizine, if you are aware of it, cetirizine is one form of antihistamine. So fat cell theory, if the child is obese, okay, since childhood, if the child is obese, naturally the number of fat cells, okay, the number of fat cells the child has is more than its peer. So what happens? Even if the child loses the fat through teenage or through early adulthood, the child is able to lose the fat. Will this child have the risk of developing obesity again? Answer in the chat box. An obese child, okay, lost weight in later part of the life. Definitely, because naturally the child has grown up with more fat cells than usual as compared to the peers. Okay, as compared to the child's peers, the kids in the same age groups in the same class, this child has naturally more fat cells. So the presence of more fat cells makes obesity a prevalent risk throughout the child's entire life. Okay, so yeah, in case of Anand Ambani as well. Okay, so that's the fat cell theory, fat cell development theory. Obese child develops more fat cells, and the more the fat cells, you have a high chance of regaining the lost weight. Even if you lose weight, okay, the prevalence of obesity hitting you back is always high. The risk always is above your head. Okay, so that is the fat cell theory. Then we have the set point theory. So body weight is physiologically regulated. Okay, there is a physiological set point. Your body itself has a timer. Okay, the body has a set point itself physiologically. Okay, and based on that set point, your metabolism will adjust. As soon as you gain 2 or 3 kilos, okay, that happens. A natural variation. Like nobody stays in the same weight. Like if you are 60 kilos, okay, you don't stay 60 kilos throughout the year. Okay, you may gain 2-3 kilos by winters, you may shed 2-3 kilos in summers. Okay, there is a natural variation. So based on this variation that happens throughout the year, your metabolism will also adjust. Okay, as soon as it's the winter time, it's a cold season, your metabolism starts to fire up, okay, to shed those extra kilos. Okay, when the summers are near, your body is trying to regulate through physiological process. The body is trying to, like, sweat and all, like through sweating, etc. Your body is trying to reduce your metabolism so that you don't lose too much of weight. Okay, so the natural set point theory states that your body, to an extent, a human body, to an extent, has certain integrities within itself to reduce the chances of obesity and overweight. But still, if the person still indulges in too much of junk food, lack of physical activity, etc., over a period of time, then this set point will not work. The set point theory will not work. Okay. So it's like your body has a signal, and based on the signal, your metabolism will either increase or decrease based on the fluctuations of weight what you are going through. Okay, but only to an extent. After that, after when you have crossed your limit, this set point theory won't work. Okay. Summers are good for losing weight. Summer season is good for losing weight. Winters are good for gaining weight. Next, there is one more theory which is not given in your textbook. Okay, that is the hunger versus appetite. Okay, hunger is physiological. Okay, hunger is physiological. Appetite is psychological. Can anyone elaborate this in the chat box? What do you understand? It could be a wrong answer as well. No worries. We will discuss it. Yes, emotional eating is appetite. Hunger is a body's basic need. When you don't eat, okay, even if you don't want to eat, okay, but your body naturally goes into a state of starvation. That means your body is hungry. Okay. I want to eat. I want to eat. That is psychological. The statement, I want food. That is psychological. Okay. I need food. I need food to survive. That is physiological. Is it clear to all? Yeah. It is basic need means I need food to survive. Hunger is there. Hunger is your survival instinct. Okay, not just for humans, even for animals. Okay, anything that is born. Okay, hunger is a basic instinct to survive. It's a survival mode. Hunger kicks in, you are in a survival mode. Okay, that is physiological. Appetite is psychological. Okay, appetite is seen in people like decreased appetite is seen in people who are grieving, who are mourning a loss. Okay, who are stressed out, who are having anxiety attacks, depressed. Okay, when you are in a celebration, okay, why does family too much of festivities and celebrations will lead to you gaining weight? You are happy, you are enjoying, and you want to add on to that endorphins by eating more. Okay, so yeah, appetites, yes, during PMS for women, during PMS it's not your hunger, it's your appetite. Okay, during PMS, the uh, the feast that you wish to eat, okay, the hunger pangs that you have during PMS, it's usually your appetite. It's psychological. The hormones are playing around with your mind. Okay. So that's the third theory. The third theory is not given in your textbook. It's just for your knowledge. I have shared you. There is no such specific test to see your fat cells. Okay, but if it is it's just it's a generalized statement that a child if the child is obese, naturally the child has more fat cells as compared to peers. We have tests for obesities. We have tests to find the body fat composition, the body muscle composition, etc. DEXA test is there. Okay, but to find the exact count of the fat cells, etc., I'm not aware of it. I have never heard of such test. Okay. Next, coming to the role of hormones. First is insulin. So, insulin, insulin usually is associated with insulin resistance. Okay. In previous classes, I have discussed on insulin resistance. Does anyone remember what insulin resistance is? Does anyone have any idea what insulin resistance is? Insulin resistance. Yeah, insulin is secreted by the pancreas. What do you mean by insulin resistance? Anyone like the previous batch students? Yeah, body cells are resistant to insulin. Insulin, what is the role of insulin? To bring down your blood glucose level. Okay, insulin's role is to bring down the blood glucose level. But what if the cells are not responding to insulin? The blood glucose level will not come down. Okay, so the pancreas will try to secrete more and more insulin. Okay, the pancreas are trying to reach a threshold where the cells will start responding. Okay, so in that phase, your pancreas are secreting more and more insulin. So when you take a blood test of a person who is obese, you will definitely find high levels of insulin in their bloodstream. Okay, as well as glucose levels will also be raised, because this insulin, even though it is secreted in such a huge amount, it is not working as how it should be. Okay, because the cells are not responding. So you will find high glucose levels in the blood test of an obese person, as well as hyperinsulinemia. Okay, next is thyroid hormone. So thyroxine levels are like serum total and free thyroxine levels are normal. But in obese patients, you will have a reduced number of cell receptors, which are supposed to interact with the thyroxine hormone. Okay. Normal levels of thyroid hormones are present, but the cells that are supposed to respond to the thyroid hormones are not normal. Okay. There are very few cell receptors available now which can respond to your thyroid hormones. Okay. So hypothyroidism has a minimal effect on long-term body weight, because for a long term, if you think that you have too less amount of thyroid hormone, that's the reason why you are overweight. But it's not the level of your thyroid hormone that's the culprit here for obesity issue. It's the number of receptor cells that your body doesn't have. Okay, that's the culprit that leads to obesity. Okay. Next, coming to growth hormone. So growth hormone, will the increase of growth hormone lead to obesity, or the decrease of growth hormone lead to obesity? When your body is not secreting enough amount of growth hormone, your body will not be able to maintain the lean muscle mass. Okay. So whatever weight gain is happening in your body, that's because of the fat mass. That's not because of the muscle mass. So definitely decreased secretion of growth hormone. Decreased secretion of growth hormone leads to obesity. Okay. Growth hormone secretion increases naturally when you indulge in physical activity, when you indulge in resistance training. Okay, the growth hormone levels will increase, and with that increase, you will be able to maintain and build more of your lean muscle mass. Okay, and when the lean muscle mass, when you are in the state of building more lean muscle mass, naturally your body fat percents will come down. Okay, then we have the hormone leptin. Okay, from where do which part of your body secretes leptin? People who are from the science background, which part of your body secretes leptin? See, leptin hormone is not secreted by any of your glands. Okay, it's secreted by your intestine. Okay, especially the adipose tissue, adipose cells that are present in your intestines. Okay, so this is the hormone. Leptin is the hormone that helps you to suppress your hunger. Okay, it is secreted by small intestine when the intestine is full, when the stomach is full, and the food has started reaching the intestine. The entire lumen of the small intestine is full of food. That's when the leptin hormone is released. That is the small intestine telling you to stop. Don't eat more. I am completely full. I have to digest food. Okay. So leptin is a hormone secreted by your intestine, specifically your adipose tissue. Okay, and because of the presence of leptin hormone, you are able to understand your hunger, when to stop eating. Okay, when to stop eating, it suppresses your hunger. You don't no longer feel hungry. That's when you stop eating. Okay, so when you do not have leptin, when the small intestine is not able to produce leptin, okay, or your body cell receptors are not reacting to leptin, what will happen? You will keep eating more, overeat, it will lead to obesity. Okay. Yeah, ghrelin is the complete opposite of leptin. So about the leptin supplements, I wouldn't recommend leptin supplements because, see, uh, this is an open-ended discussion. Okay, leptin supplements, if you take it rapidly without discussing with your nutritionist, without discussing with your physician, what are the side effects that can happen? Okay, can you just put it in the chat box? What do you think? Just imagine a situation when you start taking leptin supplements or leptin infused biscuits or any other edibles. What can actually go wrong here from a nutritionist point of view? Yes, deficiencies. Weight loss will happen because you're not eating food, but at the cost of what? At the cost of nutritional deficiencies. Okay. And also, yes, the natural way of how your body should feel hungry. Okay, because hunger is our instinct. Okay, and hunger is our basic instinct. Okay, you are suppressing your basic instinct. Okay, so that will have its repercussions as well. You will start losing your hair definitely, because when it comes to micronutrient deficiencies, it's seen on your skin, hair. Okay, your overall glow, your overall health, everything will start to deteriorate. So that's the role of hormones and its relation with obesity. I don't think so. There are food that naturally has leptin, but there could be food that enhances your leptin, that increases your leptin secretions. Okay? You can Google about those sources as well. So this is the assessment part. You can take screenshot of this these charts. Okay, the height given here is in feet. Okay, height is given in here in feet. It's not in centimeters. Like in India, we usually use height in centimeters. And the weight here, weight given here is in pounds. It's not in kilograms. Okay. So whenever you come across a client, if you want to see in height in feet and pounds, pounds is usually used in USA and Canada. That's the metric used there. In European countries, in India now we go for centimeters, height in centimeter, as well as in as well as the weight in kilograms. So the pink column which you see here, that's the height for the females. Okay, whatever height the female has, and what is the ideal weight that they have to maintain. Okay, for example, let's say a female of 5'4". Okay, her low weight range is 114 pounds. Target should be 133 pounds. High is 152 pounds. Okay, this is not in kilograms, it's given in pound. Okay, so do the calculation. For a female who is 5'4", her height is 5 feet 4 inch. Okay, what is her target weight in kilograms? Convert this into kilograms. Take your Google search and just search about it. Only the target height. I want only the target height. A lady who is 5 feet 4 inch, A target weight is given in 133 pounds. Take your Google, convert 133 pounds into kilograms. What's the answer that you found? I see people are having different answers here. It's about 60.3 kg. That's her target weight. She has to maintain her weight around 60 kg. It could be 59, 58 or up to 62, no issues. Okay. Target weight is the ideal weight. It's not the right weight, it's the ideal weight. Ideal weight. Okay. So I hope how to use this chart is clear to you. It's in pounds and in feet. Okay. Then we have the BMI. What is the full form of BMI? Yes, body mass index. And put on the formula for it. It's the most commonly used formula to assess the ideal weight for a person's height, etc. And when you're putting the formulas, please use the metrics. Please be right with the metrics. Weight in kg divided by height in meter square. Okay, that's the right way of putting down the body mass index formula. Please be very thorough. Okay, questions can come. We can give you some centimeters, cubes, squares. Okay, we can give you the wrong metrics. Okay, but if you just use weight by height square, okay, that's not the right way. Weight in kilograms divided by height in meter square. Okay, you have to be very thorough with the metrics when you mention it. Okay, so you can take a screenshot of this chart as well. So here in inch as well as in centimeter, they have given the height, and I'll give you a height. You have to find the ideal healthy body weight for that height. Okay, and here gender doesn't apply. Gender doesn't apply here. Okay, so let's take a person who is 5'9", 175.2 height in centimeters. What's the healthy weight for them? So sorry, what's their body mass index? What's the proper body mass index for them? Some sources will tell you that 20 up to 24.9 is the normal body mass index, and that's correct. Okay, 24.9 can be taken as a normal body mass index, because you have to make sure that this just gives you a body mass index. This formula will just give you the body mass index. It doesn't give you any analysis about your body composition. Okay, when you take any athletes, any sport persons, okay, even whatever their height is, most of them you will find that body mass index is near to 29 and 30. Okay, near to 29 and 30. Will you consider them unhealthy? Athletes who have their body mass index near to 29, 30, sometimes it may go to 31 as well. Will you consider them unhealthy? It's not, okay, because that's the limitation of body mass index. Remember that, that's a limitation of body mass index. It doesn't give you any insight or analysis on your fat mass versus muscle mass, your body composition, what is your bone density. Okay, these information you will not get from body mass index chart. Okay, you will only get a range. Okay, that is 18 to 24. If your body mass index is between this range, you are healthy. Okay, if it is 25, you are still healthy. Okay, because person to person, your body mass index may differ. Okay, So what is the best use of BMI? BMI is best used when you want a generalized version of a population's BMI. Okay, what is the average BMI of people who are from this state, people who are from this country? What is the average BMI of the people in this country? Okay, when you want to make a generalization for a group of people. Okay, in such cases, body mass index can be used. Okay. Otherwise, when you are being specific with certain cases like athletes, okay, people who have tumors, okay, who have heavy tumors within them, uh, and also people who have renal issues, okay, so they have a lot of water weight in them. So in such cases, BMI will not help you make a menu plan, okay, with such underlying disease conditions, which leads to a lot of water retention in the body, tumors, okay, athletes, okay, based on these backgrounds, health backgrounds as well as professional backgrounds, you have to be very tricky with when to use BMI, when not to use BMI. Okay. So what is the to the answer? What is the answer of the question that I have asked? Let's say a person is 5.9 feet high. Okay, that's the height, 5 feet 9 inch. What is the ideal weight for them using this chart? Please see the chart thoroughly. Does the chart has weight mentioned anywhere? Yes, it is from 56 to 56 to 75 or 56 from 56 onwards. You can see here the green, you have to follow the green. Even at the 18, even if the body mass index is 18, you see on top the weight is 56.8. Okay, from 56.8 to 75. Okay, that's the ideal weight range what they can maintain. A person who is 5 feet 9 inch, 56 to 75. 56 being the lowest. If they go beyond 56, below 56, they become malnourished, underweight. Okay, they should not go more than 75. So yeah, it's a 19 kg weight range. Okay, 19 kg weight range, which means you can't individualize BMI. BMI can be used to generalize or make a statement about a population, a group of people, people from certain activities or phases of life. Okay, you can make a generalized statement of BMI for, you can come to a conclusive statement of BMI for a group of people. It cannot be individualized, because when there is a 19 kg difference for at an individual level, means a person has to lose 19 kg or a person has to gain 19 kg, it's usually not achievable. Okay, it happens, but it's not that common phenomenon. Okay, so BMI is not individualized, it's just a range. It can give you an idea or a direction where the person's health is heading to be. Okay, and then you have to make a slightly individualized changes from here onwards. Okay, so the pros and cons of BMI is given on to page number 295. Such in paragraphs, it is given in lines. Just read through it thoroughly, and make sure you are aware of the metric system in BMI when you are using the formula. be aware of the metrics used in the formula. Okay. And the degree of obesity, above 40, about 25 is considered obese. Okay. 23 to 24.9 is considered overweight. Okay, from a textbook point of view, it is considered overweight, but usually otherwise we don't consider 23 to 24.9 overweight. Okay, it's considered healthy. No, normal is from 18 to 22.9. Okay, and underweight is anything below 18, it is underweight. Okay, so that's the information that is given in your textbook. So for exam purpose, just go by your textbook. Otherwise, even on the chart which I have shown on the screen, it is completely different as compared to what is given in the textbook. Okay, the chart which is used on screen is the most common one which we use worldwide. Okay, but in textbook there is slight variation in the BMI indexes that is given. So for exam purpose, be thorough with the BMI index what your textbook has given. Okay. Next is your waist circumference. So this is just take a measuring tape and see what is your waist circumference. Okay. That is your abdominal fat. Basically, where we are checking your abdominal fat. Okay. So for males and females, it is different. For females, you can nowadays everyone wears a pair of trousers or denim jeans, etc. So whatever size you go by, okay, your 32 inch, 30 inch, 28 inch, whatever is the inch size of your denim jeans, that will determine are you under the overweight category, obese, medium, or whatever. Okay, so females whose waist is less than 27.5 inch, and males if it is less than 31.5 inch, okay, you have your risk of developing CVD, cardiovascular disorders, is very low. Okay, but you can't just go by weight circumference. Cardiovascular diseases, the risk factor of cardiovascular diseases is much more than your waist circumference. Okay. Just below your navel, just below your navel. Where you, like whenever you wear medium rise jeans, okay, not the low waist one, not the high waist one. When you wear a medium regular fit jeans, regular fit pants or trousers, okay, what waist will you go for? Okay, where will the waist of those pants sit comfortably on your body? It's just below your umbilical, okay, just below your navel. That's the circumference which we are calculating here. And anyone who has above 40, if above 40 is your waist range, even for females and for males, okay, the waist inch is above 40, you have a very high risk of developing obesity and also high risk of developing cardiovascular diseases. So that's an easy measurement, easy assessment. Next, coming to measurement of body fat. So this is done in hospitals. You can go to a hospital which has the bone densitometer or the DEXA scan. Okay, DEXA scan stands for DEXA. Okay, DEXA stands for dual energy X-ray absorptiometry. Okay, on page number 295, they have given. Okay, but in short form, we call it DEXA. I have mentioned it in the chat box. In short, we call it DEXA scan. Okay. Dual energy X-ray absorptiometry. Okay. So you can see a report of a DEXA scan on screen right now. So the yellow part, whichever is a yellow to orangish colored area, so that's your subcutaneous as well as your visceral fat. Okay, and then we have the lean muscles, which are the lilac colored ones. Okay, and then from indigo to sky blue, that's your bones. Okay, the heart tissues. So the heart tissues are in blue color. Light blue colors are the heart tissues. So based on the DEXA scan, the user here, the technician here does not have to calculate. We just by taking the image of the person's body, the front as well as the back is taken. Okay, DEXA scan, the person has to lie on their back as well as on their tummy. Okay, they have to lie on both the sides, and both the sides DEXA scan is taken, and then the total surface area of fat and total surface area of muscles and the bone density, everything is calculated. Okay, so this is how a DEXA scan report looks like. So it gives you the most accurate information. DEXA scan, it gives you the most accurate information about your percent-wise information about how much fat you have in your body, what's your fat versus muscle ratio, okay, and also about your information about your bone density. Okay, are you at the risk of getting uh, osteoporosis, etc. T scores are technical. Okay, you don't have to go into that deep. Just understand this is how a DEXA scan looks like. You have to ask about the T score to a radiologist or somebody who's from a medical background. They can answer. So it's very technical thing, T score, etc. So is it clear about the DEXA scan? What's the use of it? How accurately you can understand your body fat percentage as well as the body muscle and the bone density. DEXA scan and the bone densitometer is the same thing. In any hospital, if you see they have a bone densitometry, understand they have a DEXA scan. Then we have a ponderal index. So ponderal index is somewhat very similar to your BMI. Okay. So for this, just note down the formula here: uh, weight in grams divided by height in centimeter cube multiplied by 100. Okay. So that is the ponderal index given on the screen. In textbook, they have another formula. Okay, just note down the formula differences. So you can again take a Google, open your Google browser, and go to the ponderal index calculator. Okay, just type ponderal index calculator. There are different browsers, different web pages for ponderal index. Is it open to all? Is everyone ready? So put on your whatever is your like whatever is your height, your weight. Just put those indices into the columns, whichever browser you're using. So yes, you are already giving the answers, whatever index you have found. So what is the conclusion here? If your ponderal index is more than 13, if your ponderal index is more than 13, what would you conclude? More than 13. So about the formula for control index, when you change the indices, okay, try to put your height in inches, try to put your height in pounds or weight in pounds. Okay. So in the textbook, it is written if the control index is less than 13, we consider it obese, because in the textbook they have given height, they have mentioned in inches, and the weight they have mentioned in pounds. Okay. If you convert your height and weight into inches and pounds, and then use the control index and see what answer you're getting. Okay. If the answer is less than 13, you come under the obese category. Okay. If it is 14, 15, it is optimal. If it is more than that, again, it is obese category. Okay. So please check that. So control index, you have to understand the formula which is given in the textbook. In the screen, which the formula which I have mentioned, that is in gram and in centimeter cube. So the indexes will definitely change, the answers will definitely change. Okay. So based on the textbook, try to calculate it. But if it is less than 13, it is understood that the person is obese. Okay. Textbook page number, it is 296. Textbook page number 296. When you are using the website, they already give you a commentary that your weight is normal, weight is optimal. The control index is too high, you are considered overweight. They are already giving you the statement, so just go by that. Okay. For exam formula, follow the formula which is given in the textbook. If you want to use it for your clients, just now how you have calculated your control index, use the same method. Okay, select a web page which you're comfortable with and use that for your clients. Is it clear? Because the website itself will give you the answer. Okay, if the patient is overweight, the client is overweight, optimal, etc. You are getting the answer for that as well. Is it clear to all? So use a web page that gives you the conclusion as well, not just the answer to the formula, but the conclusion as well. So you will not be confused. Okay. For client, go for control index. Don't go for BMI, go for control index. Next is your waist to hip ratio. Next assessment is your waist to hip ratio. So you just have to take a measuring tape, measure your waist and measure your hip. Okay. Waist has to be your numerator. The hip measurement should be your denominator. Okay. And whatever answer you get. Okay. So for women and men, let's type change. So women, if it is 0.80 or below, you have a low risk of cardiovascular diseases. Here, we are not just speaking about obesity. When you see low risk here, also understand it's a low risk for cardiovascular diseases. Okay, atherosclerosis and other CVD problems. So a woman whose weight to his ratio is more than 0.85, they have a high risk, and they usually will have a apple formed body. Okay, apple shaped body. And when it comes to men, similarly, if your waist to hip ratio, the answer that you get is more than 1, equal to or more than 1, you have a high risk of cardiovascular diseases or obesity related issues. Okay. So usually we say a person who has an apple shaped body, okay, that is too much of fat that has been accumulated in the abdominal region as compared to your lower body. Okay. These people have a high risk of being obese as well as developing cardiovascular diseases. Okay. Women naturally tend to have a gynecoid pelvis. They have a pear shape, but pear shape is not just seen in women. It's this is the shape which is seen in men as well. Okay, and there are women who have naturally have apple shaped body, but not the pear shaped body. Okay. Just take a measuring tape to measure your waist and hip. The Taylor's tape that you have, Taylor's tape. Next, we have Broca index. So again, Broca index in your textbook, when just speaking about the Broca index given in your textbook, they have just used one standard formula for men and women. Okay. But other sources apart from your textbook, if you search online, okay, you will get two different formulas. Okay. So Broca index is very easy to calculate. Okay, easier than ponderal and easier than BMI. You just have to know the weight. You just have to know the height of the person. Okay, height in centimeters for of a man minus 100. Okay, let's say the man's height is 175 centimeter minus 100, 75. 75 is the ideal weight. Okay, 2 or 3 kilos up or down, it will be completely fine. Okay, not big of an issue. So 75 is the ideal weight around which the person has to maintain their weight around 75 kilograms. Okay, when it comes to women, okay, let's say a woman is 165 centimeter height. Okay, what should be her ideal weight based on the formula which you see on the slide, not in your textbook, on the slide. Yes, 60 kg because you have to minus 105. Okay, for men just minus 100. For women, subtract 105 from the height. Okay, so that's the ideal weight that she has to maintain. Okay, it's not that she has to be exactly 60. She could be 59, 58, or she can go up to 62 as well. Okay, it will not be a major health concern. Ideal weight should be around 60 kg. That's it. Okay, but in textbook, it's given only height in centimeters minus 100 for both men and women. For both men and women, they are using the same formula. So these were the assessments so far. Is it clear to all the assessments? Different kind of body assessments. For a single client, you can do all the assessments, okay? And you can come to a conclusion based on all the 5 to 6 assessment which we have seen. From BMI to waist to hip ratio, Broca index, ponderal index. Okay, do all the assessment for a single client and see what majority of answer are you getting. Okay, based on that you can make a conclusion. So obesity class 1, grade 1 or class 1. In textbook, they have given as grade 1, grade 2, and grade 3. Here I have shown it as class 1, class 2, class 3. Slight differences could be there, but the meaning, okay, the concept of each of the classes, that's same. Okay. So grade 1, people who have a body mass index, BMI, above 25, but it is less than 29. Okay, so here they have given obesity class 1 as 30 to 34.9. So every source you will refer will give you some or the other different kind of answers, but for your exam purpose, go by what is given in the textbook. You don't refer any other sources outside for exam preparation. Just stick to what is given in the textbook. Okay? So grade 1 is, you can consider it overweight, not just obesity. It could be overweight as well. Okay. In certain sources, people who have a weight, a BMI within 24 to 29, okay, they are considered overweight. They are not considered as obese. Okay, only after 30, after you cross 30, it is considered as obese. Okay. Then grade 2 obesity, 30 to 39.9, that is grade 2 obesity. So they have to be treated by doctors and dietitians here. They may look healthy. They may not have a shortness of breath. They can walk. They can do their physical routine, their personal hygiene all by themselves. But still, they may have underlying cardiovascular diseases, onset of cardiovascular diseases must have begun. Okay, their cholesterol levels will be high. Okay. So in grade 2 obesity, not all your clients will have breathlessness, shortness of breath, or sleep apnea, etc. But at the serological levels, when you do physiological tests on them, you will find serum cholesterol levels quite high, okay, hyperlipidemia, etc. These situations you will find in grade 2 obesity. Grade 3 obesity, it is the most pathetic condition. Here, the patient is completely reliant on someone else to take care of them. They can't even walk. They are prone to multiple fractures, especially on the weight-bearing bones. Okay, can you name few weight-bearing bones of your body? Which is the main weight-bearing bone in your body? The main one is your femur. Okay, that is your thigh bone. Okay, knees, ankles, toes. Okay, knees, ankles, toes, calves. Okay, they are the secondary ones. The main one is your femur, that is your thigh bone. Thigh bone is the main weight bearing bone of your body. Okay, the entire weight of your thoracic cavity and your abdominal cavity. Okay, all the areas which tend to become obese sooner as compared to other parts of the body. Okay, that weight is borne by your femur bone. That's your thigh bone. Okay, so that is the first weight bearing bone. So in case of grade 3 obesity, there have been cases where when the people who are under the grade 3 obesity, they try to walk, there are chances that they may go into a femur fracture, ankle fracture, okay, the toe fractures, tarsals and metatarsal fracture. These fractures are seen just because the bones are not able to bear the weight of the upper body. Okay. So here in grade 3 obesity, surgical interventions are required. We'll see the surgical interventions later. So next coming to adipose tissue. Okay, what is adipose tissue or adipose cell? Previous batch students. It's the fat cells. It's the cells which stores fat. And adipose tissues are also responsible for making, for example, in females, okay, in females, adipose cells are responsible for making testosterone. And in males, adipose cells are responsible for making estrogen. Okay. The main hormones of the opposite gender is made by the adipose cells. Okay. So the fat distribution in a men and female is different because the reproductive purpose of the biological purpose of both the bodies are different. Okay, in women, it usually from the time she hits menarche, from the first menstrual cycle, the body has started preparing for the childbearing activities. Okay, so in women, you will see most of the fat deposits taking place, especially after menarche. Okay, as soon as the puberty hits, most of the fat cells deposition starts at the pelvic and the hip region. Okay, the thighs, pelvic, as well as the secondary reproductive organ, that is the breast. Okay, these are the areas which will accumulate the fat cells. Okay, this is the way of how the body has been preparing for the childbearing age. Okay, in men, whereas in men, most of the adipose tissues settle down in the thoracic as well as the abdominal region. Okay. So adipose cells are of three different kinds. You have white cells, white adipose tissues, brown adipose tissue, and pink adipose tissue. Okay. Out of these three, which adipose tissue maintains the body temperature? Any guesses? Which adipose tissue maintains the body temperature? It's the brown adipose tissue. It's the brown adipose tissue. Okay, that is the adipose tissue that is supposed to generate heat. Okay, brown adipose tissue is responsible for generating heat. Remember that. Okay, so when a child is born, people who are from the medical background, please answer. When a newborn is born, okay, a child is born, what adipose tissue is more in number? Is it white or is it brown? Which adipose tissue is naturally more in newborns? It's the brown adipose tissue. Okay, it's the brown adipose tissue that is more in number as compared to the white adipose tissue, because when it comes to newborns, okay, uh, as soon as they are out of the mother's uterine cavity, okay, they are exposed to the coolness of the environment. Okay, so you must have seen some kids soon after they are born, they are kept under radiant heaters, okay, radiant warmers to maintain to keep them warm. Okay, so naturally they have lot of brown adipose tissue from within to maintain the high heat. Okay, they can't tolerate the cool atmosphere once they are outside the uterine cavity. Okay, for thermoregulation, they have brown adipose tissue more in number as compared to white. Okay, white adipose tissue is usually for storing the energy, access glucose converted into fat, and all that will be converted into white adipose tissue. And what is the pink adipose tissue? What is the role of pink adipose tissue here? Yeah, pink adipose tissue is found in women, specifically on the thighs and the hip. Okay, thighs, hip, and buttocks, and this is to support pregnancy. Okay, and even not just pregnancy but also lactation. During lactation, when more energy and more fat is required to produce the breast milk, the fat from the pink adipose tissue will be moved. Okay, so is it clear about the difference between white, brown, and pink? These are the different adipose tissues and the main functions. What are the main functions of these I have discussed here? Next, coming to body shape, android versus gynoid. Android body shape is the apple body shape. You can see here most of the fat cells is around the waist area, waist to hip area. Okay, large amount of visceral fat. What do you mean by visceral fat? People from the medical background, so that others can understand what is visceral background. Visceral fat. Fat that surrounds the organs. Okay, it's not organ fat. It's not organ fat. Organ fat and fat surrounding the organs is different thing. Okay, fat that surrounds the organ for protection and thermoregulation. Okay, so that is the visceral fat. So people who have android kind of body shape, they have a high risk of cardiovascular diseases, hypertension. Okay, they insulin resistance, diabetes, dyslipidemia. Dyslipidemia means either too much of lipids in the blood, coronary heart diseases. Okay, because too much of fats are stored around the visceral area, that is your fat around your organs, important organs. Okay, coming to the gynoid, it's relatively benign health-wise, and it is commonly found in females. Okay, the fat deposits are just energy reserve to support the demands of pregnancy and lactation, which we have just now discussed. Okay, so after pregnancy, soon after pregnancy, whatever weight gain a woman has indulged in during pregnancy, it's usually her hips, thighs will gain a lot of weight along with the breast. Okay, it is supposed to support the childbirth as well as the lactation. Okay, so after lactation, most of the weight loss that the females see, okay, it's not from the arm or the face or somewhere, it's usually from these pink adipose tissue which has been boosted up to produce the milk. Okay, so it is very easy to lose the pregnancy weight, especially from the hips, thighs. Okay, when the lactation process is going. So juvenile onset obesity. It develops in infancy or childhood, juvenile, related to your childhood. Okay. By gynoid is benign means it is not harmful. Benign means not harmful. As compared to android, you can see a lot of health issues are associated with android body type. Okay. But gynoid is benign means it's not that harmful. So juvenile onset obesity, it develops in infancy or childhood. And as we have discussed in our fat cell theory, there is a lot of adipose cells seen in juvenile onset obesity. Okay. And the adipose cells, they have a very long life and they will store fat given at any chance. Okay. So just because you have lost weight doesn't mean you have your adipose cells have disappeared. Adipose cells are definitely empty or they have become smaller in size, but they don't disappear. They have a very long lifespan. Okay. That's the reason why people who were overweight or obese, even when they lose weight, okay, there are high chance for them to kick back or they bounce back to the previous body shape because the adipose cells have not disappeared. They have a long lifespan and they may have reduced the size, but they have not disappeared. Okay. So this makes it very difficult to lose the fat, especially for weight loss. If you are looking for weight loss, losing the fat, especially for kids from childhood, you have seen obesity issues, which is very difficult for you to lose weight. Causes, definitely poor dietary patterns, force feeding the child. Force feeding the child is also a cause here. Lack of physical activity, not allowing the child to go out and play, indulging them with lots of electric gadgets, etc. Okay, indulging them in junk food, unhealthy food. Okay, so 43% of teenagers will watch at least 2 hours or more of TV per day. So that's also a cause of juvenile onset obesity. Okay. So only with physical activity and restrictive diet from teenage onwards, only that could help for them to slip into a healthy lifestyle. But the incident rate of obesity striking back again is always there. Okay, that is juvenile onset obesity. Next, coming to adult onset obesity, from the name itself, it develops only in adulthood. Specifically, it is your middle age. Okay, after 30s, between 30s to 50s and all. That's considered as a middle age. Okay, so adult onset obesity usually will trick you here in these age groups. Here you have very few number of adipose cells, but these adipose cells can extend. Okay, they can store a lot of fat. They can become larger and larger. So you don't require a lot of adipose tissue, adipose cells to become fat. Okay, even with less amount of adipose cells, you can become fat. Adipose cells have a capacity to extend a lot and store a lot amount of fat. So if the weight gain continues, not just the adipose cells will become larger and larger, but it will differentiate. The number of adipose cells will also increase. Okay, so if you do not control your diet patterns, if you do not move away from a sedentary lifestyle, your obesity from grade 1, grade 2, and grade 3, immediately you will go through all these grades. Because now at early onset of adult obesity, you are just having few adipose tissue. But if the lifestyle continues, not just you end up with large adipose tissue, you also end up with a lot of increased number of adipose tissue as well. Okay, so that's a difference between adult onset obesity and juvenile